This is probably, I feel, one of the most important workshops that I do throughout the year. It's on nutrition. When I first got into practice, I didn't put a lot of emphasis on nutrition. I was more just on chiropractic. And I started realizing that, people are suffering from a lot of different problems, and a lot of it can be helped with nutrition. So, I've used a lot of different things. You can ask my wife. I've used so many different pills and combinations of stuff, all good stuff, but it was, I'll tell you why I think that what I'm going to talk to you about is better, but I've really been searching for years, and I think, it's my job as your doctor to really look through and research this stuff and then present it to you, kind of be a filter for you. So, like, should I take vitamins, what kind and how much? Get those questions from people all the time, and I used to just farm them out to other people, but I found that, by looking and researching it and talking about it with my patients, I'm getting better results. Because it's really interesting, the distance between my office and the health food store was like 14,000 miles for some people. They just couldn't get there, so that's why we kind of do it in-house. So, I've been a chiropractor since 1990. Okay, I've been doing it for many years. I've been co-authored a best-selling book. Voted one of the best America's top chiropractors by the Research Council. This is my 20th year in practice, so I've got a lot of experience with a lot of this. So the mission that I have really is to inspire you to make lifestyle changes, because that's really what this is. Whether it be nutrition, whether it be chiropractic, it's a lifestyle change. And it's important for you to look at that. If you want to look at healthcare reform, right now, my opinion is that we would change healthcare reform by teaching people about health and not about disease. And it's interesting because just the other day I have an MD that's a patient, and he came into me, and the conversation kind of went like this. What do you think it's going to take for medical doctors and chiropractors to be in more harmony? And I said, what it's going to take is for you to actually have more education about what we do. And I said, because I think chiropractors are more willing to work with MDs than vice versa. And he said he had a question on a relicensing test. He's a board certified family practitioner. He said the question was, a chiropractor or a patient presents with neck pain, and he said, the answer was, what should you do about that? Because the patient says, I have a free exam to go see a chiropractor, and the actual response, correct answer he put down was, you should go see them because it could be beneficial for you, because he's been using chiropractic for years. The correct answer was, don't refer them out because they can't do anything more than you can do in-house. And he says, what can I do, give them drugs? So it's the solution that we have with healthcare in America right now is more drug related than really solution oriented to teach people about health. So that's what my job is, to tell people about, help them stop those unnecessary drugs and surgeries.